Are smoothies safe to drink if you have type 2 diabetes? The answer is, it depends on what's in them and how much you're having. Managing blood sugar with type 2 diabetes means paying close attention to what you eat and drink. Smoothies might seem like an obvious healthy choice, but they need a bit more thought than you might expect. Here's why. When you blend fruit and vegetables, the mechanical process breaks down the fiber structure. That matters because intact fiber is one of the things that slows down how quickly sugar enters your bloodstream. So blending may cause sugars to be absorbed more quickly than if you'd eaten the same ingredients whole. That doesn't mean smoothies are off the table, it just means how you build them really counts. It's also worth saying smoothies shouldn't replace whole foods on a regular basis. The metabolic benefits of eating whole fruit and vegetables, the chewing, the intact fiber are worth preserving where you can. The NHS advises limiting fruit juice and smoothies to a combined total of 150 millilitres per day. That's a fixed cap, not something adjusted by your carbohydrate targets. Even with no added sugar, smoothies still contribute to what's called free sugars intake, so portion size really does matter. NICE guidance on type 2 diabetes, or as the clinical guideline known as NG28, recommends individualized dietary plans that focus on high fiber, lower glycemic index carbohydrates, and reduced free sugars. A diabetes-friendly smoothie should reflect those same principles. So, what does a better smoothie actually look like? The key is choosing ingredients that help moderate your blood glucose response. Leafy greens like spinach or kale make a great base. Berries are a lower sugar fruit option compared to things like mango or banana. Adding plain, unsweetened Greek yogurt, a handful of nuts or seeds brings in protein and healthy fats. And these help slow digestion and moderate how quickly carbohydrates are absorbed. For your liquid base, choose unsweetened plant-based milks and always check the label for added sugars. It's worth knowing that individual responses can vary. Some people find certain plant milks, like oat drink, affect their blood glucose more than others, so it's worth monitoring if that's part of your care plan. On the other hand, smoothies made predominantly from high sugar fruits or fruit juices can cause blood glucose to rise sharply, which can be particularly problematic for people with insulin resistance, central to type 2 diabetes. Now, what's worth discussing with your healthcare professional? Ask about how or whether a smoothie fits into your personal dietary plan, given your current blood sugar management and any medication you're taking. Your doctor or dietitian can help you tailor this to your individual needs because NICE guidance specifically recommends personalized advice, not a one-size-fits-all approach. If you're on medication for type 2 diabetes, dietary changes can sometimes affect how that medication works, so always keep your healthcare team in the loop before making significant adjustments. And if you notice any symptoms of low or high blood sugar after changing your diet, contact your doctor. To recap, blending can speed up sugar absorption compared to eating whole foods, so ingredients need to be chosen carefully. The NHS recommends no more than 150 millilitres of smoothie per day as part of free sugars guidance, and smoothies shouldn't routinely replace whole foods. Adding protein, healthy fats, and low glycemic ingredients, and choosing plain unsweetened dairy or plant-based options can all help make a smoothie more suitable for blood sugar management. If you found this helpful, leave a comment below. We'd love to know what topics you'd like us to cover next. And if you haven't already, please do like this video and subscribe to the Bolt Pharmacy channel for more evidence-based health content. Nothing in this video is a substitute for personal medical advice. Always speak to your GP, diabetes team, or a registered dietitian about what's right for you.